Hello, and welcome back to another episode of Wellbeing Insights. Today, our topic of focus is the early warning signs of dementia. Now, dementia is an overarching term that encompasses several conditions, all characterized by the impairment of at least two brain functions, such as memory loss or judgment. These conditions can significantly disrupt one's day-to-day activities and overall quality of life. But before we dive into the early signs, let's clear up some misunderstandings surrounding dementia. You see, there's often a lot of misinformation and confusion about this condition, making it all the more critical to equip ourselves with accurate knowledge. So let's embark on this enlightening journey to deepen our understanding of this multifaceted condition called dementia. Our first and foremost point is this: dementia is not a normal part of aging. This is a common misconception, as many people associate memory loss and a decline in cognitive abilities with simply getting older. While it's true that as we age, certain cognitive functions can experience some degree of slowing down, like sometimes forgetting the names of lesser-used items or the difficulty of remembering a new acquaintance's name, it is crucial to distinguish this from dementia's far more severe symptoms. Fact number 2, dementia is a collection of symptoms. Dementia is not a single disease with a specific set of symptoms. Instead, it's an umbrella term used to describe a collection of symptoms related to memory loss and cognitive decline that's severe enough to interfere with a person's daily activities. The most well-known of these is Alzheimer's disease, responsible for an overwhelming 60 to 80% of dementia cases. Alzheimer's disease has its own unique set of symptoms and progression rate, but it shares with other forms of dementia the core attributes of memory loss, confusion, and difficulty with daily tasks. Other conditions like vascular dementia, which is often the result of a stroke, or Lewy body dementia, characterized by specific changes in the brain affecting cognition and movement, are also part of the dementia family. Fact number 3, early diagnosis matters. Early diagnosis of dementia is not about hastening towards an unfavorable outcome. It's about gaining control and creating a roadmap for the journey ahead. While we may not have a cure for most types of dementia at the moment, early detection plays a pivotal role in managing the symptoms and maintaining the best possible quality of life. An early diagnosis provides the person with dementia and their families an opportunity to plan for the future. These plans can include healthcare decisions, financial planning, and discussions about wishes for future care. In other words, early diagnosis empowers people with dementia and their families, giving them a measure of control in navigating the uncertain future. Having now established a robust understanding of dementia, its nature, and its implications, it's time to illuminate the path further by discussing the key warning signs of this condition. Please remember, identifying these signs early on can make a significant difference in managing the disease. But it's important to keep in mind that these signs are guides, not definitive answers. So if you or a loved one experience any symptoms that raise concern, I urge you to bring them to the attention of a healthcare provider. Leading the list of warning signs of dementia, we have the number 1 symptom, memory loss. Now, it's important to clarify that we're not talking about the occasional forgetting where you left your keys or struggling with the name of a recent acquaintance. These can happen to all of us as we age. No, the memory loss we associate with dementia is a different beast altogether. In the context of dementia, memory loss primarily targets recently learned information. The intricacies of our brain are such that newer memories tend to be more vulnerable than older ones. Therefore, it's not uncommon for someone with dementia to perfectly recall events from decades ago while struggling to remember what they had for breakfast. This sort of memory loss manifests as repeatedly asking the same questions, forgetting crucial dates or events, or increasingly needing to depend on memory aids or family members for tasks they could manage on their own earlier. It can be especially noticeable in people who were previously very punctual or meticulous about their schedules. In essence, when memory loss starts to interfere with a person's daily activities, it's a glaring signal that should not be ignored. It's important to remember that dementia or Alzheimer's doesn't happen overnight. It creeps in slowly, often unnoticed until the symptoms become hard to ignore. Early recognition of these signs, like persistent memory loss, can be key to managing the disease. Coming in as the second major symptom of dementia, we have the sudden difficulty in completing familiar tasks. The brain is our control center, orchestrating everything we do, from tying our shoelaces to balancing checkbooks. So when dementia starts influencing the brain, it's no surprise that accomplishing everyday tasks can become challenging. With dementia, it's not the complex tasks that are concerning. Rather, it's the simple, routine tasks that suddenly seem more complicated. For instance, a person with dementia might have problems operating familiar household appliances or getting lost while driving to a familiar location. Such struggles can be frustrating and may lead to a loss of confidence in the person experiencing them. But it's vital to remember that these challenges are not the person's fault. Dementia is altering the way their brain functions and processes information, making tasks that were once second nature more complex and puzzling. Knowing this symptom can help us be more patient, understanding, and supportive when dealing with people who have dementia. Navigating to our third major sign of dementia, we now land on the confusion with time or place. For people living with dementia, the threads of time can often become tangled, and places may not always seem familiar. This isn't about momentarily forgetting the day of the week and then quickly remembering. It's more along the lines of losing track of dates, seasons, and the passage of time. A person with dementia might even forget where they are or how they got there. The confusing terrain of dementia can also lead to situations where individuals may not recognize their surroundings, even in places they've lived or worked in for years. This can be deeply unsettling and cause a great deal of distress. These moments of disorientation can happen anywhere, anytime, in the middle of a conversation, during a meal, or even in the middle of the night. They serve as a reminder of how much dementia can warp a person's understanding and interpretation of the world around them. We've reached our fourth major symptom, which is trouble with visual images and spatial relationships. This issue is not about typical age-related changes in vision, such as needing glasses for reading. It's more complex and goes well beyond just an issue of eyesight. People with dementia can have significant difficulties understanding visual information. This can range from misjudging distances or heights, struggling to distinguish colors or contrasts, to even experiencing hallucinations. This trouble with visual and spatial understanding is due to the changes dementia causes in the brain, not the eyes. For instance, a patterned carpet might suddenly seem like a dangerous hole or drop. This visual distortion can be alarming and often leads to increased risk of falls or accidents. Also, issues with spatial relationships can make it challenging to perform routine tasks like buttoning a shirt or using a knife and fork. This is because our ability to judge distances and understand how objects are positioned in space is key to such tasks. And there you have it, folks, our journey through the 4 key signs of dementia. Remember, understanding is the first step towards managing any condition. If this video was helpful, please hit the like button and subscribe to our channel. We appreciate your support in helping us share vital information like this. Stay aware, stay healthy, and until next time, take care of yourself and those around you.